Welcome to the Worldwide Doula podcast. I'm Barry, I'm a registered nurse and birth doula, and each week I'm joined by a new guest speaker to talk about all things pregnancy, birth, babies, and parenthood. So it's time to sit back and relax as we get into some juicy topics. Welcome back to the Worldwide Doula podcast. Today I will be speaking to an amazing woman whose brain I've been wanting to pick for quite some time, Dr. Jess Michaels. Jess is an osteopath in Coffs Harbour, mumma to a gorgeous little munchkin, fellow doula, and the founder of the birth sling that I keep seeing everywhere recently. Welcome, Jess. How are you?
Thank you. Yeah, thank you for having me. I'm really good. Thank you.
Good. Today, I'm going to be picking Jess's brain about osteopathic treatments for fertility, pregnancy preparation, treatments during pregnancy, and even after birth to help with postpartum recovery. We're going to be talking a little bit about the birthing sling that she's created and how it can work to make your labor and birth a hell of a lot easier. To start with, Jess, why don't you tell us a little bit about your background in osteopathy and as a doula as well?
I guess the way I came to osteopathy was because I was a professional dancer, and all through that, I had seen osteopaths. And so when it was time to hang up my dancing shoes, I thought, oh gosh, like, what am I going to do? And osteopathy was something that came to mind. I had this vision of becoming an osteopath for dancers. Like, that was sort of where my brain was going initially. But once I started studying, and the more I started to learn about the body with this osteopathic mindset, this really holistic, amazing view of our amazing body, the more I got drawn towards these other topics like pregnancy, birth, babies. I was just absolutely drawn to. And so once I graduated, all of my continued professional development was sort of in those areas. So any course I attended or trainings I did was all about either pregnancy or breastfeeding or babies. And then doing my doula training was another perfect add-on or another skill that I thought would be such a good addition to my skill set already, and allowed me access to being with women during birth, which there was a moment at one point where I was like considering going back to study and become a midwife. I think the way the system and everything is at the moment, I'm really glad I didn't end up doing that. The position I'm in at the moment just allows me to be with women in the most authentic way that I can be. So yeah, it's awesome. I love it. I love what I do.
You sound super passionate, which is the main thing. You need to be passionate about this. And I've always loved osteopaths. Like, they've been my go-to whenever I need something. I always go to my osteopath.
Amazing. Yeah, I think we're a really special bunch of people. There's this beautiful, holistic, science-based, but spiritual aspect to us all, which I love. So
yeah, it's an amazing alternative therapy. Not a lot of people actually know about. Can you tell me what osteopathy is and what the different types are? Because there's two types, to my understanding anyway.
So in Australia, we're allied health practitioners. So we do kind of steer away from that alternative word or complementary, because we're not alternative. We're part of your care team, you know. In my era of study, we did 5 years of education at university level. So we did an undergrad and a master's degree. And the thing that I love about osteopathy or osteopaths is that we're holistic. We consider the whole body and the whole person, mind, body, spirit. And once you sort of have that lens, it's hard to not have it with everything. You know, it's how we should view all people, I think, and birth included. You know, it's not just about a woman popping a baby out. It's how does it feel for her in her mind, body, and soul. And we treat the whole body. And this is how I tend to explain things to someone that just might be like, what's an osteo? I have no idea. It's like, well, the difference is, you know, you might go to a massage therapist and be like, well, I have a sore knee or a sore back, and they'll rather than massage your knee or back to help those symptoms. Whereas we go on this full journey of asking all about your previous medical history and your previous health history, and even what's going on in your social life, and figure out like what's the root cause of this pain or dysfunction.
Whenever I went to my osteopath, I went for different reasons, you know, acne or period pain. It's not like, oh, I've got a sore knee, can you help me out? It's like more inner problems. When I went to my osteopath, I also went to my acupuncturist, and it kind of went hand in hand. Those two were really amazing for me.
Yeah, for sure. I think, there's heaps of different kinds of osteopath out there too. There's
Yeah.
definitely the more sporty that help with sports related injuries, or there's just more like functional medicine osteopaths that like help with all of those more tricky or alternative type of things that might happen with, during your life. And I think it's that side of things that people don't realize that we can help with, it's a lot of people just think it's, oh, my back's sore, so I'll go and see an osteo, or that it's musculoskeletal, whereas it's so much more than that, nervous system, lymphatics, like fluid drainage, just, the whole body.
All the good stuff. There's so many different areas that you can go into. Some osteopaths crack and some people just...
I know what you mean now.
It's like a gentle way, kind of.
Yes. So you can be a direct osteopath, which is more direct treatment, like massage techniques, manipulation. So HVLA, which is like the cracking techniques that are typically associated with chiropractors. Yeah. And then there's the more gentle functional osteopath or craniosacral. So that's
the one.
Yes. To be honest, particularly where I studied, we're taught both. And I'd consider myself, I don't say that I'm one or the other. I do a bit of both, but there definitely are osteos out there that are like, nope, I don't do cranial, or I only do cranial. So I always struggle to explain it because it's just it's a whole body kind of treatment. It's super gentle. It's more what you would do on a newborn. And even I love to incorporate some cranial towards the end of my sessions with pregnant women, where it really taps into every cell in the body and calms the nervous system, and the person typically ends up floating out of the room.
I think osteopathic treatments are like next level. I wouldn't be able to explain it to someone. Whenever somebody asks me, what is an osteopath? I'm like, well, they do something. They work with the spinal fluid and it's really high tech, but I also don't know how to explain it. Whenever I go to my osteopath, I always walk out feeling like I've been beaten up, but he's really just put his hands on me and just done something amazing.
You often hear that feedback. I don't know what they did. They just put their hands on me. Or like when it's a little baby that screams and hasn't stopped screaming since they've been born. I remember a friend of mine saying like, I don't know what that osteo did, but they touched my baby and that's about all they did. And he's been amazing ever since and hasn't cried. So
if healing hands was going to be a career, that would be it.
Definitely a lot to it.
Is it safe to have the manipulation during pregnancy?
Yeah, so there are some manipulations that you would avoid and some are safe. The thing that's amazing with osteopaths is that we've got so much knowledge in like pathophysiology and understanding and knowing red flags when they might pop up. So like a contraindication to a manipulation may show up in someone's history and you of course wouldn't do it. But there are some manipulations that are perfectly safe during pregnancy. And yes, like personally, I'll do a couple of manipulations if I think they're necessary, but I'm not a huge heavy-handed kind of osteo. Particularly with pregnant women, I do lots of jiggling and wobbling, but it just really depends on how that person presents on the day. They might be super restricted and their tone may be really tense and dense, and so it might be indicated, but otherwise, if someone's really floppy and supple and everything, it's not as necessary. But yes, safe techniques like manipulation techniques that you can do during pregnancy.
Awesome. Well, that's great to hear because that was one big question in my head that I didn't know the answer to. I wanted to take a step back and talk about before you're even pregnant. What can osteopaths do to help with preparing for pregnancy in the way of fertility treatments or helping you get your body ready to conceive in an optimal way?
Okay, so first of all, I'll just like caveat all of what I'm saying is it's kind of just my own take on osteopathic principles. I don't know how much of this would be like actually evidence-based, but I think first, I always encourage anyone that's wanting to do preconception planning or that kind of thing to seek out a really good naturopath as well, because getting your levels, your bloods and iodine and your iron, all of those different levels, a naturopath that's more within their scope to check those kinds of things, and that plays a huge role. And then in terms of how the body shows up for conception planning, I think as osteos, we work so well around the pelvis and looking at fluid dynamics and if there's any sort of congestive issues going on in that area or in the whole body really. And just kind of, piecing things together. Osteos then have a good way of helping you seek out a naturopath as well and piecing all of the bits together.
Yeah, that definitely makes sense. Yeah, I did some research because I wanted to figure it out for myself a little bit and see if there were any studies behind it. And there are actually a few popped up that said that when you are having difficulties, there are some benefits to having osteopathic treatments to help with fertility, which is something that I addressed in my previous podcast, is fertility issues around coming off contraception and then wanting to fall pregnant shortly after that.
I have worked quite closely with a few women that have been on that journey, struggling to fall pregnant and have gone down the IVF route and that kind of thing. And it just really depends, again, on what that particular person needs. Nervous system work, like getting the person's nervous system in a better state and a more relaxed and grounded state. Everyone knows if you're stressing about falling pregnant, then it's like, just don't stress about it. And like, all well and good to say, because it can become such a stressful thing for women. Like when it's not happening month after month, then that absolutely becomes a stress. And I think osteopaths have a really good way of accessing the nervous system, like with craniosacral treatment and facilitating a calmer nervous system. So that's always a good place to start, at least.
Yeah. And then once you actually become pregnant, what kind of treatments is available when you seek an osteopath? What can they do for you when you're pregnant?
At different times of pregnancy, you'll generally be needing different things as the body needs to grow and adapt to the growing baby. There's different areas of the body and transitional zones that need to be able to move more. And so directing treatment specifically to those areas, and obviously just anything that might show up on a regional screen and what you feel. If there's areas that feel a bit stuck, that aren't as aligned or expanding as much with the rest of the body as the pregnancy continues, then working on that. Again, nervous system, you sort of can't do enough of that. If the woman might feel anxious or a little bit worried at different times of the pregnancy early on, might be worried about a loss if she's been through that before. It's amazing what can come through in a quick consult. A good osteopath will just get an impression and an understanding of where that person is at in their life right now, what they need specific to that. And then, of course, like getting hands-on and feeling what the tissues also need.
That's the whole essence of what you said before, treating the whole person, treating holistically, understanding the background, understanding the situation that they're in at the moment really helps to treat. And I think actually a lot of people in the healthcare industry don't look at that. It's not a holistic thing. They're just, okay, let's just talk about the problem. Let's just sort this problem out and not talk about any of the other issues. I love that about osteopathy.
One of the problems, I think, other modalities, they don't have time to even get to know, they have 5-minute consults like GPs and stuff. So how could you possibly consider the whole person in 5 minutes? It's kind of like one presenting complaint and that's it. If you have something else going on, make another appointment. Whereas my initial patient time is like an hour and 10, and then the return is usually like 45 to 50 minutes. So yes, I'm always running late too. So it's like you just need that time.
So important to have that understanding, and having that extra time really makes a difference. You're a doula also. So when you see your clients, do you offer them treatments or only when you're at the clinic?
So the way I usually plan things out with a doula client is that we design like a package specific to what their needs are, but generally they'll have a few osteo sessions during the pregnancy, and I'll usually do those at my clinic because
you have all the stuff there.
My treatment table, the portable treatment table, is not the same as working with my electric table. And for me personally, like time-wise, to be able to drive to every single different doula client's house, like I do my Tuesdays and Thursdays in the clinic, and they come to me for those prenatal sessions. And then postpartum, I'll do a couple in the house for them, like after the birth. I don't make them come out to me in those early precious weeks. So makes it work better for me.
I don't know if you've listened to my other episode. Actually, the first episode I ever recorded was with my mum.
I did listen to that one today, actually. But most of it anyway. I don't know if I finished it.
She gave a little bit of juicy gossip that after her birth, she had an osteopath come and meet her in the hospital, which I don't think is allowed.
I didn't get to that bit. I just heard all about, the twins. And I was sort of like, oh, I've got to listen to this podcast, get to know you a bit beforehand. So
she had a very interesting birth.
Yeah, definitely.
Yeah.
Oh, I'll definitely finish the rest of it, but tell me more about the osteo.
I think it was a little bit of a sneaky thing. She had the cesarean, and then after she had a lot of trouble waking up, I think they overdosed her a little bit on the anesthetic. And my sister, she actually had a little bit of brain damage because she was deprived of oxygen. She's completely normal now. And I always find this story so amazing. When she was born, she had a little bit of brain damage, and then the osteopath came and treated her. They pretended he was a friend, and they just asked for a bit of privacy, and they did a treatment. The doctors were like, oh my God, it's a miracle. She's completely normal. A few treatments completely reversed it, which I think is absolutely amazing. I think that osteopaths make a huge difference. Even if you can't tell what they've done for you, they've really done amazing work. But have you ever heard of an osteopath going and working in the hospital or being invited as allied health into the hospital?
I've definitely treated babies in the hospital. I supported a beautiful twin birth in a hospital, and the hospital wouldn't have known that I was giving treatments or anything, but I gave the boys a little treatment. And getting in early is such a good thing with newborns. In Australia, osteos, unlike physios, aren't really affiliated or associated with hospitals. We've just never really had that relationship, and it's always been more that osteos work in private practice. Whereas in England, there's and this was actually when I was still studying, I was like, I'm going to this course. There's a pediatric course for osteopaths where basically these osteos work on neonatal wards, and they're really closely affiliated with the pediatrics ward, I believe, and work in the hospitals with little neonates. So I think there's definitely a place for that, but it's just not really happening in Australia.
Yeah. I didn't know anything about a doula until I heard that something was mentioned on a midwifery podcast, and I was like, oh, what's a doula? And then I looked into it. It's the same story. When I was looking into studying osteopathy, there was only like one course that I could study in Australia, whereas in England, they're so well known. Same with doulas. Like, they're so well known. There's doulas everywhere. And even now when I talk to my friends and family, they're like, what's a doula? Oh, it's like a midwife, isn't it? And I'm like, no. Well, yeah, but we're just a little bit more, a little bit more holistic. We have the time to support you. We have the time to spend with you and help you and educate you.
Yeah, not the clinical tasks, we're not providing medical advice or...
I think it would be amazing if Australia would open its doors a little bit more.
Open their minds a little bit more.
Exactly. So then after birth, you already touched on this, but what treatments can an osteopath offer women after birth?
A big part of what I like to do before the woman has had the baby for the postnatal recovery is just education. I teach a hypnobirthing course called Born to Birth, and when the partners are there, I'm like, look, guys, or guys and gals, you need to understand how important this time of recovery is, and you need to understand what the body is actually doing. Like, yes, you've got the dinner plate sized wound from where the placenta has come. You've also got to understand that all of the ligaments and connective tissues that would normally support and hold the uterus have stretched and grown as the uterus has grown with the baby. And all of those tissues have come back to their pre-baby shape or size, but they're still, like, if you've sprained your ankle and stretched those ligaments, we're going to advise you to rest and elevate the leg and just keep off it for however many weeks. And so that's a similar thing that needs to happen postpartum, is to make sure that you don't move around too much, you don't lift too much, because you can jolt the uterus because it's not supported by really nice structured ligaments at that time. They need to come back to their pre-baby length. You're often still bleeding, and I like to encourage women to really connect in with their body. And sometimes the bleeding might go away for a day or two, and then they do something and they might start bleeding again. And it's always a really good indicator that, okay, you've done too much. And I love to make sure that the partners understand mum really shouldn't be lifting anything heavier than the baby. And if you do feel like you desperately need to get out of the house for like a walk or some fresh air, it's probably a really good idea that the partner wears the baby carrier in those early weeks, because a really tight belt around that area and then carrying the baby, it just adds pressure, and that downward pressure on the uterus, you can cause prolapse later on in the postpartum phase. And then as far as myself doing hands-on treatment, obviously I just keep things really gentle and just feeling in for what feels imbalanced or out of alignment, and helping those tissues come back to midline and helping them come back to a more balanced state. Obviously, if there was like episiotomy or C-section or any tearing involved, then we're sort of starting to deal with scar tissue, and lots can be done relatively early, actually, with particularly like C-section scars, making sure that the scar doesn't lay down all of its scar tissue. You can help those heal in a way that's more functional, and that can continue to be done even years later. Like you can feel into C-section scars and be like, oh, okay, you need to do a little bit of scar work on here, and tips on the best way to get up out of bed and how to support themselves when they're breastfeeding, and little positions that might be more supportive for their pelvic floor or tailbone or sacrum. And it's like ergonomics. Breastfeeding ergonomics is a big one. Even carrying baby ergonomics, yeah, because you're all soft and loose, and then you've got to carry this baby around and be up at all kinds of hours of the night. So yeah, it's a crazy time.
You also have a little bit of discomfort sometimes.
Oh yeah,
or a lot,
hugely.
maybe.
Yeah. Sure.
What about like the emotional side of things and the mental? I guess it's kind of going into the area of psychologists a little bit, but you can definitely help stabilize the hormones or help with feelings of anxiety and stress or other feelings that might come up after you have a baby. There's a lot of emotional stuff going on.
100%. Honestly, I think osteos have a really good foundation level of psychology. You know, I know for myself personally, like I've gone on to do my own further study in that area, because sometimes I remember having conversations with girlfriends that are also osteos, like half of what we do is actually more on that psychosocial model, you know, and really
psychological.
Yeah, meeting the person's needs there. And so definitely in the postpartum phase, it's such a tender and sacred time. And with the hormones and the huge changes and the possibility of birth trauma, even if you've had a really perfect, quotation marks, like birth, there can still be a bit of trauma associated with like the hecticness of it, the length. All of a sudden you've got this little human to look after.
Yeah.
So
it's a lot.
It's a huge part of postnatal treatment, and a big part is like education and just normalizing all of it, because everyone's journey is different. We live in this Instagram world where everything looks so beautiful and all the beige little onesies. There's more information out there these days, but living it and going through it is very different to reading or hearing someone's comments on how full on it is. But a big thing that I seem to see is a lot of people, when you treat babies, they do come in like, oh, I don't know, they won't stop crying, or they seem really colicky, or they seem really gassy. There's all of these things, and parents just want to do the best and they want to do what's best for the baby. But sometimes those behaviors are just normal newborn behavior, and normalizing that for parents, that your baby actually is going to want to sleep on you. They've been inside you for 9 months. They're probably going to want to sleep really close to you, if not on you, for the next year or two anyway. And a lot of people have this misconception that they're going to be able to swaddle them and put them down in another room and they'll sleep through the night and that will all be fine and dandy. But if we look at it from like an anthropological viewpoint, that's not normal. They're helpless, defenseless little infants that want to be close to you and on you and with you at all times.
It's nice to have those cuddly moments. You've waited this long to meet them.
Definitely.
It's okay to want that. There's a lot of information out there, and there's a lot of unsolicited advice of, oh, don't let them sleep in the same bed as you because it's dangerous for X, Y, and Z reasons. But then it's also like, don't let them get too attached with you because then this will happen later on. But I think you'll find that if you just follow what you feel is right, it's not like a baby comes with a guidebook. You just have to do it your own way and just be gentle and be slow and understanding, because they're also trying to communicate something. And because they're crying, it doesn't mean that they're bad babies.
Yeah. I read something recently. One of the best indicators for breastfeeding success was a mother that trusted her own instincts and intuition and wasn't constantly worried or looking for external advice or validation. You know, someone that trusts in their ability to know their baby's cues had a better chance of breastfeeding than someone that was looking outside for all the information. So that is always one of the biggest points that I can make to new parents is like, honestly, just really tune into this baby and trust your instincts and your intuition, because you're always going to do what's best. That's what we're wired to do. So,
exactly. The motherly instinct is real.
Exactly.
And follow it.
100%. Yeah, definitely.
Yeah. And I mean, fatherly instinct is real too. You haven't carried them for 9 months, but it's just as important for them to connect and have that time and that instinct as well to connect with them.
Yeah.
You've already kind of touched on this, but you treat children and said that it's really good to get in there earlier rather than later. What are the benefits of osteopathic treatments for children?
I just absolutely love treating babies and infants and children. It's so different treating a little one to, you know, an adult that has all its conditioning and traumas, both physical and emotional, that are affecting the body. But with regards to treating newborns, often people are like, well, it's a newborn. Like, why would they even need treatment? Yeah, what's wrong with it? And I remember one of my mentors, this sort of Gandalf-like osteopath, that he would say birth is pretty much the most hectic thing we will ever go through, you know, both as a baby and as a mother. Like, as far as physical endurance, it's a lot on the body. And if we're looking at it from the baby's point of view, depending on how the birth unfolded, there can be quite a lot of pressure down into the head, into the cranium, or if there was an instrumental birth, forceps or ventouse, then that just elevates the indication for treatment so much more. But also I talk about like packaging issues. They've sort of been in this little position, like snuggled inside the womb, likely for at least a month, possibly more. You know, we hear of those babies that are engaged. You can even see that molding in their head, in their cranium, where they really were engaged really early. And so the head shape almost molded to the mum's pelvis. So getting in early while the tissues are really soft and cartilaginous, the cranium hasn't fused, it's easier to treat newborns as opposed to an 18-month-old that is just like, no. You know, you can actually have uninterrupted time with your hands on. That's something that as an osteo that treats children, you just have to get good at. But definitely it's easier to treat a quiet, snuggly, sleeping newborn. And it can have long-reaching effects, like get in there and unwind those strain patterns that are there early. Then as the baby grows, they're not increasing those strain patterns. You know, they're not growing into them and exaggerating them further. You're just clearing the slate for the baby to then grow. And one of the things I love looking at and working with is like the primitive reflexes and checking in if they're expressing the reflexes as they should be. And then also, are they integrating the reflexes at the different times when they're supposed to? Because then that is an indicator or prerequisite for them to then express the different milestones at the right time. So it's amazing. I love that stuff.
That sounds amazing. So I want to talk a bit about your birthing sling. How did you come up with the idea?
So I was preparing for our home birth in 2021, and I definitely want to have something hooked up that I can like pull down on, like ropes or straps or something that I can hang up and pull down on. It just sort of made sense to me, particularly with like my osteopathic principles deeply ingrained in my brain. So I started tinkering around with some exercise stuff that I had at home, and we were renting at the time. So it was something that I was able to just flick over a door and not have to screw anything into the ceiling or walls or anything like that. And it was really like bootleg version of what the birth sling now is, but it was just arm straps really. I used it at different times during the birth. Looking back, I ended up having quite a long labor. And I remember thinking, God, I wish I had thought to get out of the pool and use that more. Like, I definitely spent a lot of time just in the water because that's where I ended up. And you kind of get stuck in this pool world where time does not exist. And and all of a sudden 3 days have gone past. Our beautiful midwife, or like she was an unregistered midwife, so like I guess some people
like
would say birth keeper, or but yeah, so she had a few births straight after mine, and she was like, oh Jess, can I use that thing that you hooked up for the next one? And then I remember, literally, it sounds so hippy dippy, but I was like breastfeeding my daughter under the moonlight maybe a couple months after our birth, and was looking into birthing slings and the research behind it, and then the history behind that as well, and then really started to think like, okay, how could that have actually worked better, and how could it have provided more support, and does anything like this actually exist for women? I know hospitals around the world have ceiling mounts. At the moment, they're not offering anything to the women because I don't think it's gone through the work health place and safety, but they've got the ceiling mount in the roof, and there are hospitals out there that will hook up some fabrics from the ceiling, but there was nothing for someone like me that was planning a home birth that was just quick and easy and served that exact purpose with all of the evidence and tips and tools to support women to use it for birth. And I knew women were buying aerial silk rigs basically and setting stuff like that up, but so yeah, I started looking into it and I was like, oh, this is crazy that doesn't exist. Having a baby in postpartum time, you get really creative. And so I just was like, I'm going to do this. And I worked on fine tuning the version of what I had created and went back and forth, found a manufacturer and went back and forth with them on making it just right. And I bought a small stock and that sold out really quick. And so I was like, oh, I better buy some more. And then those sold out. And so it's been really exciting to see the progression and see how well it's been received. Like literally, I think the last time I looked, I'd sent birth slings out to 29 different countries around the world. So
wow, that's amazing.
Yeah, women from 29 different countries had purchased, which I thought was really cool, just looking at location alone. So yeah.
You're really getting out there, filling a gap in the market. When I saw it, I was looking at writing an article about the birth sling. And the first time I actually contacted with you was to become an affiliate marketer for the birthing sling. I'm super excited to put that out there and, you know, educate people about the birth sling because it's obviously an amazing tool for movement and it supports you to move without having to put too much energy into it because there's so many studies out there. Oh my gosh, I've lost count of how many I've read about the benefits of movement in labor and how 100%. It can help you rather than going into the hospital and then the doctor saying, okay, it's time, get on the bed. We're going to, you know, we're going to do this. You even see it in all the movies. You're birthing on your back. So you think that's the natural way to birth. But following your body's rhythm, if you don't want to move, you don't have to move. Definitely. Don't move if you don't feel like you need to. But moving actually makes the baby come into the right place to have the optimal birth and the optimal passage through 100%. The pelvis. So it's almost like a little dance with your baby. Movement in labor is actually amazing and it's definitely not spoken about enough.
And the more you understand that medicalized way of epidurals and laying on your back to push with your leg, like it just makes so little sense when the more you understand how important movement is and intuitive movement, you know, like you said, letting the mother be guided by the sensations. And I always say the pain in labor, if that's because I know some people don't like to refer to it as pain, but I will be the first to say my labor was uncomfortable. It serves a purpose. Almost between every contraction, you find yourself in a different position. Maybe not every contraction, but as the baby navigates its way down different parts of the birth canal, then the woman will instinctively and intuitively do different movements that coincide with that stage of labor. And they're important movements. It's helping the pelvis open and flow with what the baby needs at that specific time. And I'm all for choice. And if a woman wants and chooses an epidural, that's her choice, but hold off as long as you can. If you still want that vaginal birth without instruments or anything like that, like it's probably wise that you hold off the epidural as long as you possibly can so that you get some of that physiological labor and movement that is really necessary. One of the big parts, like with the birth sling, is that I found it really challenging personally to stay in a comfortable position. And some of the, like I was constantly coming right down into not a downward dog, but like a downward dog on my knees. So almost going against gravity, but that's just what my body needed. But with the support of the birth sling, you can still be in that surrendering forward position, but you can still be a little bit more upright if you, you know, put it around your chest and lean into it that way, or it can help you into a deep squat with less effort. It's kind of hard to hold yourself into a deep squat if you wrap the sling around your back, and then you've got the arm slings as well. You can be in a deep squat and continue to sort of sway your hips and move your body as it wants to. I remember sitting on the birth ball at different points, and my midwife was stacking pillows in front of me so I could lean forward. So you can use the sling with a birth ball as well, so you're not going to fall off that in between. Because sometimes you watch women in labor, you know, and they're literally coming in and out of consciousness almost. They're likely sleep deprived as well already, and going into that real euphoric sort of state. And sometimes you see them doing those head nods, and a little bit of extra support on the birth ball or whatnot with the birth sling can be really helpful. So
yeah, there's so many positions that you can use it in.
Yeah.
I've loved watching the videos that people send in of them using it, or even practicing and getting used to using it before they go into labor. One thing I wanted to ask though is, because obviously people think, oh, if I have the birth sling, then I won't need support from my partner. But obviously that's not the case. The partner can support you just as well with the birth sling. But how are some ways that you would recommend the partner to support the woman through the labor?
Yeah, you're right. Like my partner jokes, he's always like, tell every birth partner that they need it. It'll save their backs. And like, you know, he's just, it'll save your neck from the lady hanging off of it. But he's just sort of joking. But at the same time, it's kind of, I remember one woman contacted me in DMs, like on Instagram, just like, oh my God, this is amazing. I wish I had this for my last birth. I literally hung off my husband's neck for 24 hours. And I was like, oh gosh, how's your husband's neck? You know, and she's like, oh, it's terrible. But yeah, so, you know, obviously the sling can provide that physical support and take some of the weight, but there's some beautiful videos out there where the woman's leaning into the sling, but she's also then holding on to her husband's arms or body in front of her. And it just alleviates a bit of that weight that, you know, when a woman is like bearing down because a contraction's about to come on, sometimes I've seen men really crumble under the pressure of that, because it's not the weight of the woman, it's the energy of birth. It's huge, you know, she's bringing life into this world, and you can see it, and the man's like, oh gosh, like I gotta hold this. So it can help the partner support her, and there's so much more that birth partners can do than just provide that physical uplifting support. You can stand behind her and massage her back, or counter pressure, absolutely, squeeze the hips, tickle, apply warm towels or hot water bottle. Sometimes like the woman might use it in the pool while she's in that bearing down pushing stage, and he can then be in the pool with her and just providing love and support, or all kinds of things. So you often hear that argument like, well, we don't need a doula because I'm your support, like from the husband. And it's like, look, the doula is going to be there for both of you, and this is a marathon, not a sprint. Generally, I know people have really quick bursts as well, but having another person there, it's the first time that the father's going through or the partner's going through birth, and having support for them just as much as for the birthing woman is so important. The amount of times I've heard, oh, I wish we got a doula. Like my partner, he's amazing, he was great, he's a great husband, he's a great father, but in the birth he did not know what to do. He went into fear and a bit of shock and agreed with the medical staff. Like I've just heard that so many times from women that didn't have one at their first birth, and they're like, this time I'm definitely having a doula.
Well, that's just the thing, the definition of a doula, all types of doulas. There's so many different types of doulas out there, not just with birth, but like with death, with the definition of a doula is to help you through a major life transition. And it's not only the woman going through a major life transition and the baby, it's the father as well, or the partner. And it's a lot to process, pregnancy 100%. And birth. And then afterwards as well, having those three really major events, it's huge. And And I think you need all the help that you can get, because your partner is amazing. They can support you so well, but it's really great to have that one extra person there. And even to provide education beforehand, provide education and advocation during, because the doctors come in and say, okay, this is what we're going to do most of the time. And then if you say, no, I don't want to do that, or that wasn't in my birth plan, then they say, okay, well, sign here, because that means that you're responsible if something goes wrong with your baby. And then it's like, shit, is my baby going to die?
Yeah.
And then they're scared and they just sign over, and the cascade of interventions, that's when it starts. So it's great to have that extra person who knows a little bit more about it. And we're not replacing your partner, but we can definitely help. And going back to the birth sling, it gives you the opportunity to move more and to put more weight into something that's not your partner, so that he doesn't need an osteopathic treatment after the, the birth. But it also gives the partner the ability to be more flexible and more able to go and get you a drink of water when you need it, or, you know, counter pressure, or focus more on the other things rather than just holding you up when you need it. So that's really amazing. I love it. I have loved our conversation. It's been really great, and I've learned a lot. I've known a lot about osteopaths, but I always love talking about it. Do you have any advice for women who are debating whether to go and get an osteopathic treatment, and where they can find their closest osteopath?
Don't debate, just go out and give it a try.
The
worst thing that can happen, I think, is that you go, it's not for me. But
and
I always say there's different strokes for different folks. Like, there's so many different osteos out there that generally, like, there'll be someone out there that you resonate more with than someone else. So, you know, if you don't necessarily like that first treatment, like, go and suss out someone else. And how you can find osteos, there is an association like Osteopathy Australia, where you most of, like, there's a lot of osteos like registered there, but you know, just Google search like osteopath in your local area. I think a lot of people find me on Instagram in my local area, but I don't know how that happens. It just does an algorithm or something like that. But there's heaps of us out there.
Jess, thank you so much for coming on to talk to me today. I've loved talking about all this stuff. I think it's so important to know what your options are. And for all the women out there who haven't tried osteopathic treatments, go and try it, because you don't know if you might like it or not. You can find Jess at Dr Jess Michaels, or at the Birth Sling on Instagram.
Thank you so much. It's been such a pleasure chatting with you today, and getting to know you and your podcast. And it's always fun. I can ramble on probably for hours talking about osteopathy and pregnancy and
me too. Me too. If everyone is enjoying this podcast, please make sure to give us a follow and rate our show, so that we can spread the word and educate more mamas and women worldwide. And we will see you next Monday for another juicy episode. For more information on pregnancy, birth and parenthood, head over to my website or Instagram at blissfulbirth.co. And just a little reminder, the information contained in this podcast is here to educate and empower, and does not replace the advice of your own healthcare provider.